I'm Michaela Mongura from Eminence Global PR Firm. Today we have a breast cancer awareness campaign. We call it Think Pink, Go Act, because it's a pink October and color pink is associated with our breast cancer. You know, we are advocating raising awareness about it because breast cancer is the #1 killer cancer in Kenya, and it's not only affecting women, it's no respecter of age, it's also affecting men. And as it is right now, 1% of men in Kenya, they are also getting breast cancer. So we are raising awareness about it to try to create, to help also women. Right now, we also have the change from NHIF to SHIF, and most patients are also struggling. And so we are also trying to raise funds so that we can be able to support breast cancer patients and foundations, yes. And our hope is that one day we can just see color, we can see pink just as a color and not as a color to associate it with breast cancer. So Think Pink, Go Act. It's whenever you see the color pink, you should tell your sister, your brother, your mother, your father, any person you know to go for early screening, because late screening is the one that is causing high number of deaths. Yes.
Is it a form of partnership or is it a collaboration? Have you partnered with other organizations?
So Think Pink Go Act is an initiative by Eminence Global in partnership and collaboration with other organizations. We have the Hub Karen, who have offered us this space, and also they are sponsors for the Think Pink Go Act. We have NCA, we have that is National Construction Authority, we had KENCO, we also have KEPSA, Kenya Association of Private Alliance Organization, and also we have other organizations who have come here like Aga Khan, that are offering free screening. We also have Britam. We have a range of different organizations that have come on board to support this initiative. Yes.
What other future projects do you have in line?
So next year we are planning to do a more bigger, better Think Pink Go Act at the continental level. We're going to try to mobilize all African countries to participate in the Think Pink Go Act. So we're calling upon all organizations in line with cancer and NGOs, private sector to support this initiative so that we can one day fight cancer completely.
I was to ask you, what would you advise or what's your word on organizations that have not yet embraced the breast cancer, especially now during this awareness?
Yes, this is October. We approached so many organizations, and some of them actually say it's not in line with their goals. But I'll say that cancer is not a respecter of person. It can be your sister, it can be your daughter, it can be your mother. So we are calling upon all organizations, that they should be able to support CSR activities. And this is not only CSR; it's a matter of national health. So organizations from small to medium to large to multinational, it's important that you join the initiatives in the country, CSR projects, to support them in however you can, in kind or monetary. Yes.
I was diagnosed. First time it was at stage 1. Went through the treatment for a year because they differ. Hormonal, and mine was HER2 positive. No, HER2 positive goes for longer treatment. It goes for a year. And also, after the treatment, I've waited for 2 years to do the normal routine check. I was in fear, of course, to go check and be told that it is not yet gone, only to find sometimes years later, it was back. I started having heavy breath. I could not breathe well, especially when I'm sleeping. So my hubby tricked me to the hospital. Can you go check the breast surgeon? And that's how I got screened for the second time. Yeah.
So before that, had you ever seen any symptoms or signs? Did it ever cross your mind? Were you
the first time or the second time?
The first time, before you even got diagnosed. Did you ever experience any pain or any symptoms?
I had a lump on my right breast, which kept on reminding me, got to be checked, but I could not go because of fear. Yeah. Until when I could not sleep on my belly because it was kind of when it got pressed. It was so sensitive, I could feel the pain. That's when I went to the hospital.
That's when you took the step to go for your first treatment?
My first check, yeah.
So now you're on your second treatment.
Yeah.
How has the journey been for the treatment?
It is not easy. Cancer treatment, it is worse than the cancer itself.
because of the finances, the challenges?
Finance is one. Two, the what do you call them? The side effects. They are too harsh than the cancer itself.
What are some of the side effects?
Low white blood cells count, very low platelets, HB goes down, loss of appetite, loss of weight, yeah, and loss of hair, of course.
And what are some of the challenges that you go through?
In terms of finances,
In terms of finances, in terms of your emotional support, or how do you get support? Do you get support from friends, family? How has your life been? How is your life different before cancer and now after being diagnosed with it?
I can say support, I have good support from my family, my employer, my friends. On that side, I can say I'm well supported. Yeah, I have never had a low moment when I have been having good support around my people. Yeah,
Would you advise someone who has recently been diagnosed with cancer?
it is not a life. It is not a death sentence. Cancer is curable. I'm the second time survivor. I can say cancer is not a death sentence, but the treatment itself can be more scaring than the cancer itself. Yeah, but when you're diagnosed early, it's better. It's better managed because it is less aggressive and it has not maybe touched so many other parts of the body. Yeah. It had disappeared, but I don't think it was fully disappeared. Could be
Around which year?
2020. 2020, it was around 2020.
When you were first diagnosed? When you were first diagnosed, it was around which year? So that I can
It was around 2020. No, 2019. About mid 2019. Went through for the treatment until around the following year, July. Yeah, and then I came to realize, okay, somehow the first treatment didn't go well with me. I don't know whether it was the medication I was taking, I don't know. I don't know what went wrong somewhere along that treatment. Because according to the current oncologist, the one I'm working with right now, kind of tells me that the first one shouldn't have reoccurred. Being a breast cancer, I did a mastectomy, meaning that you have removed everything that had cancer, their surroundings, but now it had to come from the wall of that breast where it was seated. Yeah.
You say that. You said that's what type of cancer?
It is.
Is it a genetic cause or what is it?
I wouldn't say it is genetic because in my family no one has breast cancer, but the other cancers, it could be genetic, I don't know. Whether they are all related, but mine was not hormonal. It was estrogen or prostrogen or whatever. Mine was HER2 positive, which does not involve any hormone. That tells me it's not hormonal because it's not involving what we are sharing with other people in my family.
So my name is Dr. Mokuhe Nganga. I'm a breast surgical oncologist at the Aga Khan University Hospital. Basically, I'm a breast cancer specialist, and we are here today at Karen just to enhance awareness around breast cancer.
Now that the cases of breast cancer have escalated, what are some of the causes of breast cancer?
So there is no known real cause of breast cancer, but we have found that there are some genetic factors that play a role. Genetics is what runs in families, but for the vast majority of women, they get breast cancer even without a family history. There's nothing that you can do. You can't say that your diet is a problem, even though there are some minor risk factors associated with diet, but the biggest risk factor is genetic.
What are some of the early symptoms and signs of breast cancer?
So for the vast majority of women who have breast cancer, they actually don't have symptoms. Most women with breast cancer, you find that that you have breast cancer because you've had some imaging, some scans. Usually we call them mammograms. So most women don't have. For the ladies that actually have breast symptoms, the most common symptom is a lump that is not painful. So you'll actually just feel it as maybe as you're putting on your bra or as you're taking a shower. You'll feel something, it's not painful, it's not bothering you, and that's usually the most common. Some ladies, their nipples, they change the way the nipple looks. Maybe it begins to look a little flatter than usual. Others, the skin changes, so maybe it looks very red or it begins to peel. And those are the more common things that ladies come complaining about. For most ladies, breast pain is not a sign of breast cancer.
If detected early, is there any chance of getting treatment, or how is the procedure of getting treatment
Yes.
if detected early?
Yes. If you detect breast cancer early, it is curable. It's something that you will be treated for and will live the rest of your life without it being a challenge to you. So early breast cancer, early detection always means a cure. If we detect your breast cancer late, where it has spread to the rest of your body, we can manage it, but we can't cure it.
Now, during the awareness, most people are scared of doing the breast cancer screening. Probably that is one of the reasons why the cases are escalating. What would you advise people on the cancer screening?
Yes. So the reality is in Kenya, we have very bad cancer outcomes. And the reason is because most of our patients come in very late, and not just breast cancer, prostate cancer, lung cancer, liver, all our cancers. Part of the problem is you go to the doctor or you go to your clinic and it takes a while for them to actually get the diagnosis. Most people, even when they're a little scared, they don't want to visit the doctor, so they prolong the visit, they push it forward until they postpone for a couple of months. And this usually leads to some poor outcomes because you will actually get it diagnosed pretty late. So what I'd encourage women is that every time you go to visit your gynecologist for the normal annual checkup, let the gynecologist have a look at your breasts and let them talk to you about what you can do to detect the breast cancer early. Another thing is men also get breast cancer. And it's important that they know this because men almost always come late, partly because they didn't know they have breasts that can get breast cancer, and two, there's a lot of shame about breast cancer in men. So it's important that men also have a look at their breasts and know what feels normal and what is not normal.
And tell us more about the treatment. How effective is the treatment? And are the treatments different depending on how the cancer is escalated in a patient? Yeah.
Yes. So the treatment is what we call multimodal. So it's not like the way you have high blood pressure, so we give you tablets to lower your blood pressure. With cancer, you have to hit it from different angles. So if you have an early breast cancer, the kind that we can cure, for most patients, they'll need some sort of surgery to remove the cancer. Some of them will need some radiation treatment in addition to the surgery. And radiation, very simply put, is using forms of X-rays to treat any cancer, actually. Some patients need chemotherapy, and some patients need hormonal therapy. So it's different types of treatment, all targeting one cancer.
And what are some of the challenges that you go through while giving treatment to the patients? Probably your equipment. Are there shortages of equipment?
Okay.
Any challenges that you face?
So at the Aga Khan Hospital, it's very well equipped. But let me look at this as a country, as a national issue, because this is really what it is. The greatest challenge oncologists have is one, cost of care. The truth is most of our patients cannot afford cancer care, even the ones with insurance. It reaches a stage where your insurance dries out and your finances dry out. And once that happens, you stop your treatment. And once that happens, your cancer progresses and the outcome is bad. So cost is important. We are having challenges with access to drugs in the public sector. So a lot of my colleagues working in the public sector will tell me that, we are lacking this particular drug, which is an issue. And sometimes machines fail us. And especially in the public sector, when the machine fails, treatment is delayed.
Okay, you've mentioned something about when you've left treatment. Now, if you're diagnosed with cancer, does it mean, is there a stage, it reaches a point where you're done with treatment and the cancer is completely gone, or how is it?
Yes. So if you have early breast cancer, we can treat you to a point where you're cured and you stop your treatment and you move on with the rest of your life. Late breast cancer, the one that has spread to the rest of your body, is lifelong treatment.
So hi and hello. My name is Barbara Obesa Magui. I'm a clinical nurse, reproductive health nurse, and I also do maternal child health. I work in a maternity department at Aga Khan University Hospital, Nairobi, then Parklands.
Tell us what you're doing here today. Is it creating awareness, and what exactly you aim to achieve today?
So today we have come to create it's a cancer awareness month, as we know. So we've come to create an awareness in the community. So basically what we've done, so initially we've just come like beyond from the hospital walls. So instead, like waiting for the patients to come and just come for us there in the hospital, we've decided now to come out of the hospital, come to the community now to show them we are actually available, we are here. You can be free to come beyond, like from the hospital. You can get us here from the community. Yeah.
What would you say about the self-examination test?
Yeah. So the self-examination, it's just a simple, it is a simple and an ineffective test done by the patients just to check if you have any sign that can it not necessarily conclude that it's a cancer, but something that can show it's actually a sign that can be a cancer. Yeah.
And how often do you offer support to patients who've already been diagnosed with cancer?
As-
Follow-ups and-
who have been diagnosed
Yeah.
with cancer. So it really depends. It really depends because we have stages. But now, generally, we definitely will have to welcome you with a smile, give you, especially when you come to the hospital, definitely will be anxious, will be nervous. So we'll give you the psychological support, the spiritual support that you need. And also now when it comes to the professional and the clinical, we'll usually do follow-ups. The doctors and the nurses, we usually have an intercollaboration whereby we arrange follow-ups of the patient. We even go further by even calling you. If you miss an appointment, we call you. We also have home visits. We also have follow-ups when it comes to your nutrition. We also have counselors. We also have psychologists that should follow you. It's a whole aspect of your health, the disease itself, your nutrition, your well-being in terms of your mental health. So it cuts across. Yeah, we cover all aspects because definitely it will affect your health, your mental health and everything.